Hello and welcome to Med Tutorials. This is your place for simple and easy to follow tutorials in internal medicine. If you're new here, please consider subscribing to the channel for future updates. Today is going to be level 3 in the series titled Decoding the ECG. If you're an absolute beginner to ECG, you can't make head and tails out of an ECG, I suggest you see level 1 and 2 and I've put the link in the description box below. Today is level 3 and today is going to be dedicated to all about the 12 lead ECG. Why do we need 12 leads in an ECG and how do we get these 12 leads? That's all coming up in this tutorial. So let's get started. So why do we need 12 leads in an ECG? Won't a single lead be enough to show all the waveforms in an ECG? Well, it's similar to asking why do we need so many cameras in a soccer match or any other sport for that matter. A single camera will give you a good view from only a certain angle, but multiple cameras help you to see a more complete picture of what's going on the soccer field. Similarly, when you use multiple leads in an ECG, it helps you to view the heart from different angles to give you a better picture of what's happening. Now, traditionally, 12 leads have been used, and in most cases, they should suffice in giving you an overall picture of the heart. There are certain conditions where we may use additional leads. So what are these 12 leads and how are they arranged? We will see that in the next few slides. We have 6 limb leads and 6 chest leads. The limb leads record the electrical activity of the heart in the frontal or vertical planes, while the chest leads records the activity in the horizontal plane. The 6 limb leads are named 1, 2, 3, AVR, AVL and AVF, while the 6 chest leads are named V1, V2, V3, V4, V5 and V6. So to recap, the 6 limb leads look at the heart in the frontal, or we can say the vertical plane, while the 6 chest leads look at the heart from the horizontal plane to give us a 3-dimensional view of the electrical activity of the heart. Now we will look closely as to how we get these limb leads. We have electrodes that are attached to the right arm, the left arm and the left leg. The electrode is connected also to the right leg, but it functions as a ground to prevent alternating current interferences. If we take the 3 recording electrodes, we get a triangle known as the Einthoven's triangle. Now leads 1, 2 and 3 are called bipolar leads as they record the voltage differences between 2 electrodes placed on the limbs. So lead 1 gives the difference between the left arm and the right arm electrode. Lead 2, the difference between the left leg and the right arm electrode. And lead 3, difference between left leg and the left arm electrode. The next 3 limb leads are called unipolar as they are directed to a single lead. They are also called as augmented leads because the voltages recorded by the electrocardiograph have been augmented by 50% over the actual recorded voltages. So we understand the lead name as an abbreviation. AVR stands for Augmented Voltage Right Arm. AVL, Augmented Voltage Left Arm. And AVF, Augmented Voltage Foot. We can draw the triangle so that these 6 leads intersect at a common central point. We can now have a clear understanding of the direction that each lead is oriented to. To be able to accurately determine the axis of the heart, which we'll be seeing in the next level tutorial, it is useful to memorize this diagram and know where each of these leads are directed. Now coming to the chest leads. We have 6 electrodes that are attached to the chest wall using the rib cage along with the left mid-clavicular anterior axillary and mid-axillary lines as markers. V1 is on the right fourth intercostal space just lateral to the sternum. V2 is on the left fourth intercostal space just lateral to the sternum. Then we go over to V4, which is in the left mid-clavicular line in the fifth intercostal space. V3 is midway between V2 and V4. V5 is in the anterior axillary line in the same level as V4, and V6 is in the mid-axillary line, again in the same level as V4. The positive poles of each of these unidirectional chest leads are now shown in this diagram. So now that we have an orientation as to where the positive poles of each of the 12 leads point to, it will be easier for us to understand which part of the heart is best viewed in which leads. The inferior part of the heart is best represented in the leads 2, 3 and AVF. The lateral part of the heart is best represented in the leads 1, AVL, V5 and V6. The anterior part of the heart is best represented in the leads V1 to V4. The right side of the heart is best represented in the leads AVR and V1. I hope you were able to grasp the concept of the 12-lead ECG. This is building up to the next tutorial where we'll be determining the axis of the heart, and we'll be looking into axis deviation, left axis deviation, right axis deviation. So if you're interested, please do subscribe and hit the bell notification so that you'd get future updates. So till the next time, bye-bye.